my name is Victoria. I'm going to be your nurse today. How are you doing?
I'm good.
Okay. So can you verify your name and date of birth for me?
Tiffany Welke, 4/19/89.
Okay, perfect. So I provided for privacy of washing my hands. Let me just double check your name and date of birth on your wristband. Perfect. Okay. So I'm going to actually ask you a couple questions while I put on my gloves. So I'm going to start with your head. Where are you at today?
The doctor's office.
Perfect. What day of the month is it? I'm sorry, what month are we in?
We are in March.
Okay. And what day of the week is it?
Sunday.
Perfect. All right, so patient is alert and oriented ×3. Her dress is appropriate for situation and weather. Her speech is appropriate. All right, go ahead. Put your head down for me. All right. Checking for any lesions, abrasions, or infestations. None are notated. All right. Donning off the gloves. All right. So go ahead. I'm going to touch your face, okay?
Okay.
Close your eyes and tell me where I'm touching.
Forehead. Chin. Cheek. Cheek. Nose.
Perfect. Open your eyes. All right. Now raise your eyebrows. Puff out your cheeks. Smile for me. Okay. So cranial nerves 5 and 7 are intact. All right. And now I'm going to check your eyes. All right. So eyes are not draining. Sclera is white. There's no redness noted. All right. Now we're going to check your pupils. Perfect. Perfect. Pupils dilated to a 1. Okay. Now I'm going to check for accommodation. So following this pen light with your eyes only.
Okay.
Perfect. Okay, so pupils are equal, round, reactive to light, and accommodating. So now we're going to do the 6 fields of gaze. Ready? Perfect. Doing good. Perfect. Okay. Now you're going to cover this eye, right? And tell me when you see my fingers.
I see him. I see him. I see him. I see him.
Okay, I cover this eye. Tell me when you see my fingers.
I see him. I see him. I see him.
Perfect. Okay. So cranial nerves 2, 3, 4, and 6 are intact. Now we're going to check your nose, okay? So go ahead and lean back a little bit for me. There's no drainage, no deviations. Nose is symmetrical to the face, okay? Now I need you to cover one nostril. Breathe in for me. And another nostril. Breathe in. All right. So nose has patency. Cranial nerve 1 is intact. Okay. Have you had any pain or irritation with your ears?
No.
Okay. So I'm going to touch your ears. All right. Tell me if you feel any pain.
No.
Okay. No redness or swelling is noted on the ears. So now I'm going to check for impacted crewman. Okay. None noted. No impacted crewman is noted on that side. All right. Now I need you to close your eyes. Okay. Tell me what side you hear noise on.
Left.
And what side do you hear noise on? Right. Perfect. So cranial nerves 8 is intact using the finger rub test. Okay, and now I'm going to move to the mouth.
How's your day going?
Good. It's kind of cold outside.
Mm-hmm.
All right. So go ahead and open your mouth for me. All right, dental is good. Mucous membranes are pink and moist. Tongue is midline, pink and moist. Uvula is midline. Go ahead and say "ah" for me. Okay, tonsils are at a +1. All right, go ahead and gag for me. Okay, patient's able to gag. Go ahead and swallow. Okay, perfect. Cranial nerves 9, 10, and 12 are intact. Patient was able to swallow. All right. Now I'm going to have you press your hand against your face against my hand, but don't let me push you. You push me, okay? Go ahead. Okay, and go ahead and turn your head. Okay. Now I'm going to go ahead and put my hands on your shoulders. You're just going to shrug for me.
Yeah.
Perfect. Okay. So now I'm going to go to your lymph nodes. We're going to start with the submental, submandibular, tonsillar, preauricular, postauricular, occipital, posterior cervical, anterior cervical, and supraclavicular. Any pain or swelling?
Nope.
Or tenderness, rather.
Okay.
Okay, and so now I'm going to start with your hands. Let me see your hands. Okay. Check for capillary refills. Perfect. Capillary refills are at less than 2 seconds. All right, now we're going to check your brachial pulse, radial pulse. Whew, long day. Brachial pulse.
Tell me about it, sister.
All right, now I'm going to check your carotid. Okay, and now your other side. Perfect. Okay, now I'm going to check for skin, edema, any pain? Nope. Okay. So skin is dry, warm, and normal temperature. The color of the skin is appropriate for a patient's race. Okay. Now I'm going to go and check for heart sounds. All right. You ready? So we're going to start with the aortic valve, which is the right sternal border, left intercostal space. The pulmonic, which is the left sternal border, second intercostal space. Erb's point is third intercostal space, left sternal border. Okay, tricuspid, if you could lift your shirt for me. Okay, so tricuspid is going to be the fourth intercostal space, left sternal border. Okay, and then let's move your hand just a little bit for me.
Okay.
Okay, and the fifth intercostal space and the midclavicular line is the mitral valve, and it is the apical pulse, which you would auscultate for 1 full minute. Okay, now I'm going to do your breath sounds. Alright. Perfect. And, alright, so we're going to start with your bruits. Go ahead and put your head up for a little bit for me. Alright, check your bruits with the bell part of your stethoscope. Alright, no bruits are noted. We're going to go back to diaphragm. Go 1. Take a deep breath 2. Take a deep breath 3. Take a deep breath 4. Take a deep breath 5. Take a deep breath 6. Okay, lift them up a little bit for me. Okay, we're going to do 7. Take a deep breath. Okay, we're going to do 8. Take a deep breath. We're going to do 9. Take a deep breath. Perfect. All right, so now I'm going to have you stand up for me. Turn around and face the table for me. All right, perfect. So now I'm going to do your breath sounds on the back, okay?
Okay.
All right, so we're going to start with 1. And we're going to start with 2. Take a deep breath. And 3, take a deep breath. And 4, take a deep breath. 5, take a deep breath. 6, take a deep breath. Okay, take a deep breath. 7. Okay, and 8, take a deep breath. Okay, so patient's breathing is normal. No adventitious breath sounds are noted. All right, so now I'm going to have you take a deep breath. I'm going to check for thoracic expansion. Go ahead and take a deep breath. All right, so thoracic expansion is 1 to 1. Okay, you can let go. Okay, so now I'm going to have you bend towards the bed for me. Perfect. I'm going to just put my hand right here. We're going to check for cervical spine. So I'm going to follow the spine of your. Okay, perfect. So patient's spine is normal. No curvature is noted. No concave. Okay, now I'm going to do tactile fermentus. Where I place my hands, I need you to say 99 for me, okay?
99. 99. 99.
Okay, so tactile fermentus is positive. Vibrations were noted. Have you had any flank pain?
No.
Okay, so now I'm going to check for CVA. So I'm going to, and tell me if you feel any pain, okay?
Okay. No. No.
Okay, so during CVA, patient noted that she is non-tender and no pain. So now I'm going to have you do range of motion with your arms, okay? So I'm going to want you to put your arms out for me, okay? Now can you do a circle for me? Perfect. Okay, and now can you bring your arms towards you? Perfect. And now can you bring your arms behind you? Perfect. Okay, thank you so much. Now you can put your arms on the sides. Okay, now I'm going to have you close your eyes, put your feet shoulder width apart, and we're going to check for your gait. Okay, so just stand there. If you feel woozy, you can hold on to the table in front of you. All right, perfect. Okay, you can open your eyes. All right, you can turn around. All right, so you're going to take 2 steps forward towards the door. All right, and now you're going to turn around, take 2 steps back towards the bed. Okay, so Romberg test was completed. Patient was able to complete it with no problems with gait or balance. Okay, now if you want to go ahead and get back up on the bed for me,
Okay.
we're going to check your abdomen, so go ahead and lay down for me. Perfect, okay, so I have to do your abdomen like this, okay. All right, so upon inspection, abdomen is flat, non-distended. If you had any, when was your last bowel movement?
This morning.
Okay, and when was your last menstrual?
Started today as well.
Okay. Now, have you had any abdominal pain?
No.
Okay, have you had any problems with defecation?
No.
Okay.
Defecation's pooping, right?
Yeah.
Okay.
All right, so I'm going to go ahead and I'm going to start in the right lower quadrant. All right, we're going to go in the right upper quadrant, left upper quadrant, and the left lower quadrant. Okay, so bowel sounds are normal. Okay, now I'm going, was there any pain with that?
No.
Okay, so now I'm going to palpate lightly on your abdomen, okay?
Okay.
Tell me if there's any pain. Right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Any pain? Okay. No masses were noted. Okay, now since you're laying down, I'm going to go ahead and I'm going to move towards the feet, okay? So normally we would check for the femoral pulses right in here in the inner part of the thighs, but I'm not going to do that today.
Okay.
Okay, so what we're going to do is we're going to start here and do popliteal. Perfect. Okay, now I'm going to do the dorsopedialis. I'm going to bring my tray over because in order to palpate for your feet, I have to be able to feel it, okay? So I'm going to do your dorsopedialis here. It's at a 2+ bilaterally. And we're going to do here, which is your posterior tibialis, which is bilateral 2+. Okay, now I'm going to take off my gloves. Okay. Now I'm going to check for capillary refills. We'll do your ankle clonus. We'll do your reflexes starting with your Babinski. But first we're going to do your capillary refills. If I can get my gloves on. Okay. All right. Okay. So patient did have paint on her nails, but I was able to note that the capillary refill was at a less than 2 seconds. Okay. So now I'm going to go ahead, pull back on my hands with your feet like you're pulling off the gas.
Pulling off. Okay,
Yeah,
pulling
pulling
off
off.
the gas.
Okay, now push the gas. Perfect. Okay. Patient was able to do ankle clonus. Okay, now I'm going to test Babinski. Okay, and yep, patient's able to do that. All right, now I'm going to go ahead and I'm going to do the Achilles. Okay, ready? Okay, Achilles. Okay, Achilles. All right, go ahead and start for me. I'm throwing off my gloves. All right, so I'm going to have you I'm going to check your patellar reflexes, okay? Right here. Okay. Patellar. Okay, let me see your hands since we didn't do these. Brachioradialis. Bicep. Bend your arm a little bit for me. There we go. Tricep. Let that finger move. There we go. All right, ready? Brachioradialis. Perfect. Bicep. Okay. Tricep. Perfect. Okay. So pulses or reflexes are done. All right, now I'm going to have you pull against my hands.
Pull.
Yeah, you're going to pull my hands.
There you
I'll push my hands.
go.
Okay, so patient had full muscular tension, full body. Patient's pulses were 2+, full body. Her A to P ratio is 1 to 2, no barrel chest as noted. Her breathing is normal, no abnormal rhythm. Patient was not using accessory muscles to breathe, and there was no cough noted. Okay, and I think we're done. Is there anything that I can get for you?
No, thank you.
Okay, so I'm gonna give you your call light. I'm gonna wash my hands. I'm gonna provide for privacy, document my findings, and then I'm gone.